Welcome to Podcast, the Business of Dentistry Podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hi, I'm Donna, one of the regional support managers for Practice Plan, and today I'm joined by Chloe Anderson, who's a treatment coordinator at one of my practices. Hi Chloe, thanks for joining us today. Would you tell us a little bit about yourself and your role in the practice?
Yes, Donna. So my name's Chloe. I'm a treatment coordinator for the Elegant Smiles group. I work at most of their practices, but I am predominantly based in the Grantham practice. I started in dentistry about 15 years ago as a dental nurse, and I did around 10 years of nursing. I then left dentistry because I didn't know what I wanted to do. And a job came up at my old practice. So it was Appline Dental Care was then taken over by Elegant Smiles, and under Elegant Smiles, they was offering a patient care coordinator role. And my friend Bryony, who's a nurse at the practice already, messaged me, have I seen it? And I was like, yeah, really tempted. And I said, oh, do you think, Justine, my manager, who I love dearly, would have me back? And I was encouraged to apply. So I did. Had a phone call with Justine and came in, met one of the owners, had an interview, was offered it that afternoon. And I just, like a storm, came trooping in.
And not looked back since.
Not looked back since. That was 3 years ago, April. So I've been back a while, and I'm now, my role has increased, and I'm now treatment coordinator, but I still go by patient care coordinator as a title. And I love it. Absolutely love it.
Yeah, it pulls you back in, doesn't it, dentistry? We try and leave, and then we end up
you just can't,
back
can
in the
you?
fold.
No, it's a love or hate role, and if you love it, you love it, and you're there forever, and that's that.
Well, Chloe, obviously we've worked together, all the time that I've looked after your group, and I know that you're a really fundamental part of that team and a fundamental part of kind of the plan side of things as well. So I wonder if you'd just kind of outline a bit how that patient care coordinator role works within your practice. What's the patient journey that includes yourself within that?
So it depends on the clinician, and it depends on the treatment itself. Usually I have a lot to do with new patients, so they will make like an online inquiry, and it's me that will call them, speak to them, and at that first conversation I introduce myself, introduce them to the practice, talk about a new patient examination, talk about plan straight away, sow the seed for that straight away, and they would then book in their new patient examination with me. Going forward, I would then be involved if there was a plan question that reception couldn't handle. But Donna, my reception team are fantastic, and they all live and breathe Practice Plan. So a lot of it they can answer on their own. I would get involved in big treatment plans. So if a patient has got, a bit of a hefty treatment plan, the clinicians don't always have time to answer these questions in surgery. Even though we allow a lot of time, they want to keep it as clinical as possible. So I come in if the patient is unsure, if they have any questions, they want to talk about payment plans, finance, anything like that. Because I've got a clinical background, it really helps. Yes. And the clinicians will utilise me quite a lot with that. Sometimes they'll come up and grab me, can I have a word with a patient while they're here? And of course I will. And for new patients, that's my role. For implants, Invisalign, I've got a bit more of an involvement. I will do consultations with patients just to save clinical time for a clinician, make sure they're interested, take base records. Because I'm GDC registered, I can do that. So I do have quite a lot of involvement with the patient journey, but it is different for each clinician and each treatment.
Yeah, fab. And I think you've hit the nail on the head there, Chloe, that although you allow plenty of time clinically, the challenge for a lot of patients is that conversation's very clinical in surgery. And also it's in a setting that some patients can feel a bit uncomfortable with, can't they? Particularly if they're nervous. So having you able to step in and take that patient away from the surgery, sitting in a separate room where they can be a little bit more honest with you, I think
Yeah,
sometimes than they perhaps are
they
with the
do.
dentist.
Yeah.
They can open up a bit more about maybe what they're concerned about or their reservations, or like you say, it could just be how are they going to fund the treatment. So, I think it's a real crucial role for most practices, particularly a group like yourselves and the size you are. So if you were sort of thinking about what considerations maybe a practice might need to think about if they don't have a treatment coordinator or patient care coordinator, what advice would you give to a practice considering introducing that role?
Absolutely introduce the role. A lot of practices that have never had one, I don't think realise how useful we are, especially if we have a clinical background. Even though it's not essential, it's handy because a lot of the time they can save the clinicians a lot of clinical time when it comes to scanning patients, helping with treatment plans and things. They need somebody. You have to have a specific kind of personality, I believe, to be a TCO. You have to be quite bubbly, confident, able to have difficult conversations, because that does happen sometimes. I've had some not very nice conversations in my office, not so much a patient complaining, but patients open up to you. And, I've been told a couple of not very nice things about a patient that made me concerned about that patient. You've got to have empathy. You've got to be able to gain rapport with a patient. And I don't think if they're, say, advertising for a treatment coordinator, it's not somebody that they're going to, give that they already know that's within the practice already. I don't think you can know that person in one interview. I think definitely get to know that person that you're going to have as part of your team, because the relationship between a TCO and the clinician, it has to be 100%. You've got to be able to be honest with each other. And I think, in any practice there's a hierarchy, and I absolutely respect that a clinician is higher than myself. However, if I've got to have a difficult conversation with a clinician, I will do. If they're a bit behind on things, I've got the confidence to prompt them and stuff. So I think it's got to be somebody who's able to do that, who's very well organized as well, because things can get forgotten, the workload we have and the amount of clinicians we have, and just someone that you can get along with, really, someone that you can have a laugh with and things, because we're at work, it's got to be a nice atmosphere, but somebody that is going to be good with patients, that is going to be bubbly, gain rapport, help you along, because I think that's part of why a patient stays with you, when they've got a dental team that they can trust in. And it's got to the point now where I'll walk in the waiting room and I'm saying hello to patients all the time, because they've seen me at some point throughout their journey, even long-standing patients. So definitely get a TCO. If you're unsure, absolutely get one. Speak to one of my dentists. I feel like they can't live without me.
Well, I think that's true. And
I believe that.
You juggle an awful lot of dentists, particularly if you look at across the whole group, Chloe, and the personalities are so different, aren't they? That, how do the dentists respond to working with you, given the different personalities? Because I'm sure you'll have some that really embrace your role and some that are perhaps a little bit more reluctant to utilise your skills.
Yeah, so I think one of the clinicians, it took me, I would say, about 6 months to fully build a relationship with them. They were quite a reserved clinician. They wanted my help, but it's almost like there was a line, and I needed to get across that line. So it was just a case of proving what I can do, that I'm, helpful, reliable, and everything like that. And we ended up with a really strong relationship after that, but it took some time. I was quite lucky that I was a nurse in this practice before, so a lot of the dentists knew me already. That really helped, but there was a lot of new dentists that didn't, and we've still got new clinicians coming in that are starting to utilize me more. The best thing about it is when it's a new clinician, Justine, our practice manager, or group ops manager, should I say, she will show them around, and she'll always introduce me to a new clinician and explain my role to them. And you can see like the cogs ticking, and they're like, oh, all right then, and I try and be, well, you know me, Donna, I'm very bubbly anyway. So I always like to treat them all the same. I am who I am, and I don't feel like I have to change the way I am for different clinicians. Some clinicians will just utilize me more. Some are a bit more self-sufficient and will only use me when they absolutely need me. Others I do more or less everything for. So it depends. It's about, I think you've just got to know the personality of that dentist, and you've got to know the personality of who you're working with, and straight away, right, what do you need me for? What do you need me to do? How can I help you? And just set the scene straight away.
Yeah, perfect. And I think you do that so well. And like you say, if they realise the value add that you give, actually, the more they realise that, the more they will utilise you, which is exactly the place you've got to in that time you've done that role, which is amazing. Do you find that the treatment uptake levels have improved because of your role, Chloe? Is that something that you monitor in practice?
I believe so. I think the main way that is, again, if it's a long-standing patient who never really has anything done, when I've spoken with them and explained, again, because I've got clinical background, I can explain pros and cons of a lot of treatment options, and it might be something that they haven't considered for a long time, and then after a couple of conversations with me, they will. I've had patients that I've had to kind of coddle a little bit and work with for quite a long time, especially for the big treatment options like your full arches. I had one who was wanting it for so long and it just wouldn't make that jump, and it got to the point where they would message me, can I come and talk to you? I'd have a cup of tea waiting for them, and I'd be like, yeah, come on in. And eventually they had it done, and it took time, but the clinicians haven't got that time. And it's all about, I think, is that if they feel they've got the care within the practice, not just by the clinician, they know that's there, but they've got the support of the support team, so they all know that they can contact me for absolutely anything, as in they can WhatsApp me, ring me, whatever. I do believe knowing the patients, knowing they've got that, it sets us apart from other practices that may not have that, and that's why they tend to go for the treatment more. So yes, I do believe it does. Yeah, definitely.
I think often as well, I mean, clinicians with the best will in the world, bless them, do kind of expect when they sort of present treatment to a patient that the patient will just say yes. And as you and I know, different personalities of patients, if you think about kind of personality profiling, there'll be some patients who are instant decision makers, and there'll be others that need an awful lot of time and a lot of detail and a lot of nurturing. And for me, I think that's where your role is so fundamental, because you can take that time to keep nurturing those patients who do need a little bit more than a quick decision in the surgery. So you're likely to get more conversion from those patients, particularly because you've got the time, like you say, to just come and have another cup of tea with me. Let's have another chat through it. What are you concerned about? What are your reservations? So I think it's an absolute role that's worth its weight in gold, personally, in a practice.
Yeah, I agree.
What role do you think you play within the plan journey? So you mentioned earlier, Chloe, that, your reception team are spot on, and they are. We've got them to a really good place where everyone in your practice can talk about plan really confidently. But where does your role fit in the plan journey, do you think?
Now, I feel that my involvement isn't as heavy as it was when we first started the conversion, but I know we're going to talk about that later on. Now it's more if a patient has any queries about plan, if they are unsure, whether the monthly fee is worth it, any kind of, if there's any conflict with a patient, that's where I'm more at, and kind of, keeping on top of the statements, how many, the new joiners, the leavers, things like that. I'm here now predominantly for if it's something reception can't answer, but when I am talking to new patients, I'll always talk about plan. Sometimes I'll cover reception, and if it's a pay-as-you-go patient and they're having 6 monthly checkups and hygiene, and I'll say to them, has anyone spoke to you about plan? And I'll speak to them on reception about it. But now it's more kind of, because reception, they're brilliant, they really are. And I think like you said, Donna, we've got to a place where we have a couple of plan champions in our practice. It isn't just me. I worked with you very well in the beginning to know plan quite well, so then I could, explain it to the girls.
Yeah.
So now I'm not as heavily involved as I once was, but it's still there. Like, I talk about it multiple times a day. It's there. Yeah.
Yeah. And it fits in so well in your role, doesn't it? Because like you say, you're heavily involved in sort of Invisalign and sort of the orthodontic consultations, and they are ideal plan patients, aren't they? You know, I always say to you guys, why would you invest that kind of money having treatment to have lovely straight teeth and then not be wanting to attend regularly to maintain that? So you feeding that in from that very first consultation is key, because your general patients who don't have that high treatment, you know, desire, like you say, reception have got that nailed. Everyone in the practice can talk about plan, which is great. That's always the aim we want to get to. I'm a firm believer you should never have just one person in a practice that can talk about plan, because the minute you're on holiday or you're out the business for any reason, the whole system falls down. So I think you've got a great balance of kind of the girls deal with the general day-to-day stuff, you pick up the more complex stuff, and like you say, you're the one that's looking at statements, you're the one that's checking the patients are assigned to the right dentist, and you know that patients are paid, etc., etc. So I think it's a really good combination that you've got going on in the practice.
It is. It works very well for us.
Yeah, you've kind of mentioned you would talk to new patients about plan. So this is kind of probably more a reception sort of role now. But then what happens once the patients have been told about plan by you initially? What does the next bit of that journey look like in your practice? Who talks to them, and, you know, who says what really in the practice? What role does everyone play?
So if I've spoke to a patient face to face about plan, I'll then, if they've already had a new patient exam and the clinician has prescribed a certain plan to them, then I'll do a handover at reception, and the reception team will sign them up or send them a home link. They'll get them to fill the form in to sign them up. More often than not, we get a lot of uptake from that, doing a handover like that. If I've spoke to them over the phone and booked them in for a new patient exam over the phone, I will put a note on the record, have discussed plans with patient. I'll ask the dentist to please prescribe the right plan, and I'll leave a pop-up note for reception, please discuss plan on the way out. Brilliant. So it's kind of something that's always mentioned at every step of their journey. And more often than not, you know, they'll either want to sign up or they will ask for a home sign up link, which the home sign up link you do have to keep an eye on. But they spoke about it every step of the way. So it's about kind of planting the seed initially, and then the dentist will then talk about it, and then the reception will then talk about it. So they then think, oh, well, maybe this is a good thing then. Let me do that. So it's everybody's role, but I always leave very accurate notes. If I've not spoke to the patient directly in person, I'll always leave a note, please prescribe the plan, you know, whichever plan's more suitable for this patient. Yeah.
And you picked up on a key thing there, Chloe. As you know, I always try and train all of my practices to do that prescription, because, you know, quite often I'll hear dentists say, oh, the plan I recommend for you. And like we've discussed before, a recommendation you can negotiate with. A prescription you can't. So when we sell plan the right way, which is around the health message and keeping a patient healthy through regular attendance, etc., the only way you can do that is if they're on the right level of plan for their dental need. So again, you know, I think nailing that process is so key, and having the dentist do a little bit of it in the surgery again is fundamental to plan growth, because it's the dentist the patients ultimately trust. So if they're talking about it in the surgery and they're prescribing the plan, the patients understand the importance of the plan. So when they then come back to reception, that communication between the surgery and the desk is vital, but then the desk can pick up where the dentist has left off and close that sale effectively with the patient on the desk, which, you know, is fantastic. Exactly what we'd ask you to do. Now, you touched on it earlier, Chloe, but you have had a number of dentists convert out of the NHS, and that's kind of been an ongoing project for, you know, a good 18 months, 2 years of our initial journey with you. Your role in that was pivotal, really, and was very different from kind of the role you do now with Plan. So do you mind just sort of talking me through what role you played during those conversions and what that looked like in practice for you guys?
Yes. So basically having conversations with patients about the letters they received to convert. The first one was extremely difficult, and I was kind of like a safety net for the reception team. We were all just getting to know plan, and it was knowing what to say. I mean, thankfully you were there, Donna, for the first couple of weeks to help have those conversations, but your support was really good, because we could listen to what you were saying and how we can then implement that. So once you'd kind of left us to do it, I was doing what you were doing. So I was working on reception, I set up on the back, and it was having conversations with patients, and a lot of them weren't very nice. It was just to kind of explain the benefits of plan, the problems within the NHS, dealing with those that reception felt that they couldn't deal with. When you've been bashed a few times, it gets tiring. So I was just kind of trying to be the backbone there, just to have the conversations with patients, being called this and that and unmoral and ethical, all this. I think what people need to realise is we were predominantly NHS for over 30 years.
Yeah.
And a lot of our long-standing patients came as younger and then brought their families, and there was generations of patients that were still under our care. So it was a massive deal for them, and I do get it. I do appreciate that, but it was really just to have difficult conversations with patients and just educate kind of the dentists. And if the dentists were like, oh, this one's receiving benefit, and I said, but if you do it for one, you got to do it for all. You can't do this. It's gonna bite you. It really is gonna bite you. So just offering the support really for the dentist, for the reception team, being there for the patients, having conversations with patients, and each conversion got better. I think the first one was there was learning to be done.
Yeah, it was
from
tough.
that. Oh dear. But I think with that came a lot of improvements, and also other practices in the town started doing it, and the NHS thankfully then started to be in the news quite a lot. So patients were expecting it, and you got the odd one that didn't, but thankfully all of our clinicians that converted have got a really good plan list now. Some was better than others, but the dentists that have been here a long time that had a bigger patient list, a lot of them did follow that dentist. So it was work that paid off well. It was hard work, don't get me wrong. And I think again, that's why if a practice is considering doing a conversion, definitely get a TCO or somebody that can support the reception team and the support staff and the dentists as well, because it was mainly front of house that got the brunt of it. But dentists were being questioned in the surgeries, and sometimes I was there to take the patient into my office and have that conversation with them, put their mind at ease and things like that. Definitely have someone that can do that. I think practice managers are too busy. They're running a practice, that they haven't got the time for that. Reception, a front of house, they're having to deal with a lot. Their jobs are already very busy. So having somebody that's outside of that, that's part of the support team, I think it really helps. We've had conversations, Don, and you said I felt my role was really important in that. So thankfully we're on the other end of it, and it's all fine. And we still get new patients. It was a bit quiet for a little while, but people are just getting used to the idea that the NHS is unfortunately failing, and it's the world we live in now. So that helped us out. I mean, the first one we did, it wasn't really broadcasted as frequently. So patients, I think, just thought they were just using it as greed. Oh, they've been taken over. It's greed. It weren't that. We know it weren't that. So it's just about educating patients, really.
Yeah, I agree. Like you say, your first one was challenging for a number of reasons, but predominantly because you were kind of a little bit before the kind of mass exodus that we've seen since. So each one that you did after that got easier and easier, because almost the patients were kind of expecting the next letters to come, and they've probably thought they've had a little bit of a reprieve for a while because we've not done one for a little while with you. But that first one was difficult, and you were new to plan, and you know, there was a lot of learns from that. But you're right, having somebody, you know, like yourself and like me, Chloe, that can kind of just sort of parachute into reception, but not be that front desk person that's taking the batter in, day out, because conversions can be like that. I mean, I've never done a conversion yet where there's not been any backlash. So, you know, I think it is easier for me and you to kind of be able to step in, see the girls, you know, let the girls see how we deal with things, but also to keep that positivity up, because, you know, it can be draining on reception when you do a conversion. And don't get me wrong, you know, it's different in every practice how much backlash you get, usually depending on how many other practices around you have gone private. But I think having somebody that's dedicated to that role in a conversion is so key. And either that is a treatment coordinator, or like you say, it's a member of the team that's not dealing with the day in, day out stuff on reception, but is there to support the conversion. And that's something that I think every practice should consider if they're going to convert, even if it's one dentist or if it's a whole practice, who's going to be that front of house support person for your team. Because we'll do, you know, as much as we can with you in practice. And like you say, I was there for the first few weeks, and then ongoing, I felt like I lived in your practice at one point. But there has to come a point where we step back and we let you guys, you know, run with it yourselves. So having that good infrastructure around a conversion is really valuable. So Chloe, can I ask you one final question? Do you think it's important for a treatment coordinator to do some kind of official training course, or is it something that you think you can be upskilled to do within your practice?
Both. I did a course. I did a patient care coordinator level 2 with, I think it was the Dental Nurse Network. I did it. It was from home, didn't take very long. It kind of helps with communication skills, because even though we're good at communicating, I think the patient journey from A to B, you can then take from that course and then tailor it to suit your practice. So I think both. I think you do have the skills to do it. I think the right kind of person can absolutely excel in this role. And if they've, you know, they don't need to have clinical background. It does help, but they don't need to have it. It's predominantly an administration role. However, it's how you talk to people and the organisation side of it. But the course definitely helps. It kind of helps you with how far you can go with it as well, like what you are allowed to do, what you are allowed to say. It gives you the confidence to just take the role and run with it. And then you can have those conversations, you know, with your clinicians. Oh, in my course I learned this is what she said, what do you think? And you know, it's trial and error, and you can pick a lot of things up by courses. So I've done that one. I've also done one with Invisalign. I went to the head office of Align, and I did a TCO course with them. So I'm a trained coordinator with Invisalign. Again, you pick things up about the patient journey. You don't have to do everything they say, but you take a lot from it, and it does help you in your role to do regular training. And more often than not, you get a lot of free ones. Like if you sign up for a lot of things, I've done like social media courses and stuff like that, and a lot of it's just free. It's just an hour webinar, and it's amazing what you pick up. Like I sometimes have them in the background whilst I'm working, and I will listen to it, and you do pick things up. I don't think you're ever going to be 100% at a role. I think I do all right. I think I do fine, but there's always something to learn. There's always something I could do differently. So I think definitely you have to have the foundations of it. That can't always be trained, I don't think. But, you know, after that, definitely do courses. The patient care coordinator course I did was fantastic. It touched on everything that's part of the role. A lot of stuff. I think a lot of practices have a TCO but don't actually know what they can do and what they can help you with. So by them doing that course, they can say, well, actually, you know what, I can do that. I can help you with that. So you haven't got to do it. And it definitely helps with that. So do a course as well, and just keep up with it. Keep doing regular check-ins, and if you see anything free webinar that you think is useful, just do it, because we're never 100%. So
we can always learn stuff, can't we?
absolutely. Every day's a school day, Donna.
Yeah.
You know that.
I think you're right though, because I think you do get quite tunnel vision in your own practice, and particularly if you recruit for that role from within. So if it's someone that's perhaps been a nurse like your route was, actually you've not seen any other practice, you've not seen how TCO works elsewhere. There's no real kind of standard to work to it. You end up kind of fudging your way through it a little bit, and actually having a course where there is a structure, and like you say, you can take the bits from that you think that will work for our practice, because there's not one rule fits all. I see lots of different roles of TCO, from what you do to somebody who sees every patient, someone who only sees Invisalign patients. So there is a real raft of different TCO roles that I come across. So I think having a course that you can have some structure to never hurts, does it?
Definitely not. And also there might be something within your practice that isn't working as well. I've had to do a lot of trial and error. So I came in where, we didn't really have anything. And, my role, I kind of sculpted myself. So I took on something. I'd be like, do you know what? I'm not busy enough. I can do more. I can do more. And over the years, I've picked up, a lot of jobs within this role. We take a lot of external referrals as well. So it's me that does all of that and manage the specialist diaries, and so you've got to be kind of clued up on all treatment options, but there might be something in your practice that's holding you back, and you don't always see it because you're doing it day in, day out, like you said, and you kind of build the role into what suits the practice, but there's always room for improvement. And I think doing these courses, we've done one of your guys' conferences with Michael Bentley, fantastic. Like he sheds light on it, and he kind of talks about it from a clinician's point of view as well. He respects and agrees with the TCO role because he's done it, and you pick up things. It might just be one thing you take away from any course, webinar, whatever, but it might be something that you can trial in your practice and it works really, really, really well. It will help with the conversion of treatment. It will help with patients feeling comfortable. We've trialed a lot of different things. I feel like we're at quite a good level now where we've got a good workflow for each treatment, but there's always
time,
room.
It
does. It takes time, and you have to work with the clinicians. Like, the clinicians have to be on board with you. Like, if I want to make a change, I'll sit them down. Look, I want to try this. What do you think? Or is there anything we could change? You have to have regular check-ins with your clinicians, especially the specialists like the implants and Invisalign and stuff. You do have to have regular check-ins and make sure that what we're doing is working. And thankfully we're at quite a stable level now. But again, if there's anything I pick up from a webinar that I like the sound of, I will put it forward and I'll say, do you know what, should we try this? What do we think? And it's just little things, but definitely, do the training. Like, just take any training you can, especially if it's free. It's an hour out of your day. You can have it on while you're working. It's an hour out of your day. Like, go do it, because I think if you are passionate about the role, as I am, you want to be doing the best for your practice all the time. And you need help with that sometimes. There might be something you've not thought outside the box or whatever. So it's definitely, you've got to be passionate about this role. You've got to be passionate. You've got to love your practice, get on with your clinicians, want to do the best by them, because that will it's not just a job. It really isn't. It's a lot more. You've got to enjoy what you do, and that will make you then excel in your role.
Brilliant. Chloe, thanks so much for today. It's been a great insight into the role you do and kind of how practice can consider bringing that role in. Really appreciate your time today. Thank you.
No, that's no problem, Donna. Thanks for having me.